on this. Okay, so I'd like to welcome Suyin. Suyin is a friend of mine. We went to school together. I think I've known Suyin since I was 15 or 16 years old. And Suyin is actually a trained nurse from the UK, but she has relocated to Canada. And after she relocated to Canada, she has actually pivoted and became a doula. Okay, she's not just any doula, she even trained people to be a doula. So I would like to invite Suyin to give a talk on what is being a doula like, and actually how to make a business out of it. I feel that nurses will make the best doula because they have all the experience, and also we need to move forward from being the traditional doula that we see that, you know, and what should, how supportive can doulas be? So, Suyin?
Hi.
Hi.
So today I'm going to talk about postpartum care first, and then we'll talk about the doula stuff. And in between, I will just bring in some information about what we do as doulas. Is that okay?
Yeah.
I'm just going to share my screen.
So we will take question at the end, but if really honestly you have any question, just shoot it.
Yeah, they're going to type it in the chat if they have any questions.
Yeah, that's right.
Yeah. So who am I? So I own 2 businesses. They're doula businesses. As Betty said, I'm Malaysian. I went to England to train to be a nurse. In 1992, I graduated. I became a registered general nurse, and this is like my career progression. So I became a midwife in 1995, and then I worked there till 2009. We left England in 2009. My husband got a job in Trinidad and Tobago, so we went and lived there for a year, and then we moved to Canada in 2010. So I'm living in Thornhill, which is about 35 kilometers north of Toronto. And when I came here, I tried to get my license to practice as a nurse here, but the Canadian system is really protective of their own professionals. And because I didn't have a BSc in nursing, even though I had part masters, I had all sorts of things. I was a nurse practitioner in the UK. I could prescribe drugs, whatever. All that didn't really matter to them. And in the end, I kind of gave up on that route and decided that, you know, I was going to do something else. Now, as nurses, you guys know, and midwives, we have lots of, we have a lot of transferable skills. We have people skills, communication skills. We have, you know, all sorts of skills, all sorts of knowledge that we have that, you know, we can help people in a different way. We don't just have to work in hospital. We can work in people's homes. We can support people in different ways, right? So someone said to me when I was doing a course in one of the colleges here to try and get my license to practice as a nurse here. In the end, they said you had to do a whole nursing thing again. And I said, no, I'm not doing the whole nursing thing again. I'm 44. I'm going to be too old by the time I get out. So they said, oh, why don't you, look into becoming a doula? So at that point, even I didn't really know what a doula was. I mean, I kind of heard of it before, but because in the UK, where everybody has a midwife to look after them when they're pregnant, the doula community is not that large. So what is doula? A doula is a Greek ancient word meaning woman slave. But in more modern terms, really, a doula is someone who serves women, who is with women when they're having babies and after they've had babies. So I researched it. I researched a few organizations, and I chose Kappa to train with, because Kappa not only had birth doulas and postpartum doulas, they also had prenatal doulas. Then they also had childbirth educators, new parent educators, lactation educators, all in one organization. So that meant that, if I had to buy membership for all these certifications that I was going to do, I would only have to pay one membership. But, Kappa is also a really great organization. They have headquarters. They have businesses all over the world. So there's Latin America Kappa. There's also Kappa in India, but their headquarters is in Atlanta, Georgia. Yes. So then I also became a certified maternity and child sleep consultant in 2020, because I found that a lot of my clients were struggling with baby sleep and their own sleep and sleep in pregnancy. So I thought, I'll just go get some knowledge. This will help my practice, and not necessarily wanting to become a consultant, though I do have this qualification. So I don't majority of my business is doula work. I don't do so much sleep consulting, but if people ask, then, you know, I do sleep consult, but I kind of like weave it into my doula work as I'm supporting my clients. So in 2013, I opened Cherry Blossom Doula Services. Now, why Cherry Blossom? Because the yin part of my name means cherry blossom in Chinese. So that's it. That's why the business is named after me, basically. So in 2013, it was a sole proprietorship. And then my business got really, really busy. And then, so in 2019, I incorporated and became a company. And then in 2021, a colleague of mine said, hey, you know, we want to, would you like to become a partnership? We can offer a few other things, you know, we can have it all as a one-stop shop. So in last year, we formed Thornhill Doulas. So Petra Novell, who's a trained maternity nurse from the Netherlands, but now in Canada, we run Thornhill Doulas. And through Thornhill Doulas, we run workshops for new parents, we run workshops for expecting grandparents, we sleep consult, we also provide, it's a doula agency. Okay. So postpartum care, the new mom. Postpartum care of the new mother. Today, we're going to cover a little bit about the physical changes, C-section recovery, and warning signs and red flags when we should go and refer for further help. You know, that's out of the scope of a doula or a nurse. So the postpartum period, there are 3 phases. Phase 1, initial acute period, which involves the first 6 to 12 hours postpartum. Now, delivery suites are very busy. Labor wards are very busy. Nobody stays downstairs in the labor ward for 6 to 12 hours after a delivery, unless, you know, it has been a quite a complicated birth and long time in recovery. But most hospitals, and especially in the UK, we would only keep our patients for about 2 hours in delivery ward, and then they would go up to the postnatal ward if there are beds available. So the first phase is a time of rapid change with potential for immediate crises such as postpartum hemorrhage, uterine inversion, amniotic fluid embolism, and eclampsia. So it's quite an important time, and 2 hours is, you know, almost like the minimum amount of time that, you know, you want to keep somebody down in labor ward after delivery, just to make sure that they're not bleeding, making sure that their blood pressure is normal, that they're not going to, you know, start fitting because of eclampsia, that their uterus is contracted down and they're not bleeding a lot. And, you know, hopefully the baby has, if they're intending to breastfeed, been to the breast and had a first breastfeed. So all those things. Then, you know, phase 2 is the one that most doulas are involved in. So it's the subacute postpartum period, which lasts from 2 to 6 weeks. Okay, so during this phase, the body is undergoing major changes in terms of hemodynamics, genitourinary recovery, metabolism, and emotional status. Nonetheless, the changes are less rapid than in the acute postpartum phase, and the patient is generally capable of self-identifying the problems. So if the mother doesn't feel well or whatever, she's more than capable to tell you, okay? So it could be anything from the perineum is hurting and, you know, from the healing, from the stitches, from whatever's happened down there during delivery. And then, you know, to anything, you know, that through that to baby blues, to depression, you know, to breast engorgement. In this stage, the mother is, you know, able to tell us that, you know, something is not quite right. And then phase 3 is the delayed postpartum period, which can last up to 6 months. Okay, changes in this phase are extremely gradual and pathology is rare. This is the time of restoration of muscle tone and connective tissue to the pre-pregnant state. So returning the body to the pre-pregnant state. And although changes are subtle in this phase, we still have to remember that a woman's body, nonetheless, is not fully restored to pre-pregnant physiology until about 6 months post-delivery. Okay, so then how much maternity leave is there in Malaysia nowadays? How many weeks?
I'm not sure. I gave birth so long ago.
You didn't even have any maternity leave with Jia Wei. So Jian Wei. So yeah, so you know, is it 6 weeks? 12 weeks?
No. I think it's more now. How many months? I think it's maybe 3 months, 2 months. I'm not sure at all.
Well, even 3 months, the body is not really ready. It's not even like back to its state before it got pregnant, and already women are going out to work. So, you know, we have to be, as women, and we're giving birth and stuff and having babies, we have to look after ourselves as well, right? So,
Yes.
okay, so this is something from,
Somebody
this
mentioned
is, say again, how many months?
3 months. Some
3 months.
months. Some said, yeah, most said 3 months. So I think it's 3 months.
That's good. I am really happy to hear that. I think when my mom gave birth, it was 6 weeks for me. So good, at least it's doubled. Okay, so this is like a North American perspective. Like Dr. Betty said before we started all this, we had a little chat before the webinar started. Like in Malaysia, hopefully, most mothers are still having a little bit of traditional care, like a confinement lady coming to look after them for 30 or 40 days, doing all the massage, the urut, all the binding, all the Chinese, all the foods that you get to eat, and someone's looking after the baby for you and you're resting, right? But, in the more developed world, right, this is what happens. For the next 2 weeks, you're going to feel like you've literally recovering from a car accident. But instead of nursing you back to health, we're sending you home to be the primary caretaker for someone you just met 5 seconds ago, who is also recovering from a car accident. Here are some mesh panties and a squirt bottle. Oh, and you can also take the swaddle home for the baby. The hospital right after I gave birth. So this ugly Volvo, she writes a blog, and this was how she felt after she gave birth. And yes, hospitals here in the UK do give these mesh panties to hold the pads in place. And they do give you a squirty bottle. Some hospitals also give you a sitz bath. Okay. So after a woman has safely negotiated the physiologic hardships of pregnancy and the 3 stages of labor, the attention of virtually everyone, family, friends, and caregivers, often turns to the infant. The enormous physical and emotional changes required to return from the uterus of term pregnancy to the non-pregnant state are underappreciated and often under-evaluated. So postpartum care, even in the doula, not so much in the doula world, because postpartum support is so important. We feel that we do a valuable service to our women. We support them through this period. But in the medical profession, the big event is the baby. Right. So we are looking after this woman while she's pregnant, making sure she's safe, making sure she's healthy because she's growing a baby. Then we're looking after her when she's in labor, making sure she's okay. Then, the big event, everybody wants to be at the big event. Then the midwives want to deliver the baby, the OBs want to deliver the baby. Everyone's looking forward to this baby arriving. So this baby arrives, and then the baby becomes the star. And then the mother, unfortunately, becomes a Cinderella again. So I always call postpartum care the Cinderellas of birth services, because nobody wants to do it. Nobody wants to care. And even when people come to visit the mother after they have the baby, a lot of times they will bring things for the baby, and they forget that, really they should be bringing more things for the mother. So yeah, so that's why I'm passionate about postpartum care, because I am the one that, I can be one of the people that will look out for the mother when everybody else is looking out for the baby. I'm going to play you a funny video right now as to how postpartum, the postpartum period feels like after you've given birth.
I'm covered in donut right now.
Can you hear it?
Yeah, I can.
No, it's just maybe don't get it.
Blur though.
Does everything that has to deal with post-birth make you feel so unattractive? It's not easy after pregnancy feeling good about yourself.
Tell me about your huge underwear that you.
No, it's lagging. I can't hear it anymore.
Yeah, let's just be honest.
Oh, you can't hear it anymore?
Totally
Okay, no, it's back. It's back.
little
It's a bit
Okay,
laggy.
hang on a minute.
I have a little damage back there. I don't need
Hang
to
on a
wear
minute. Let me just reshare it
fluids
with
to be wearing
No,
a thong.
I got one
That's
after I
it.
had my daughter. I'm not bragging, but my doctor was like, geez.
Yeah, it's the worst.
Yeah.
Nothing-
I had no idea.
Not
Sorry
only are you
guys,
trying
let
to
me
like
start
make
this
this
again. This will be better.
I'm covered in donut right now. Oh, look at me.
Can
I'm
hear it?
disgusting. No, just maybe don't get it in your bra.
why does everything that has to deal with post-birth make you feel so unattractive? It's not easy after pregnancy feeling good about yourself.
Tell me about your huge underwear that you.
Okay, that's not
That
a good
you've been
lead-in.
bragging
That's
about.
do you wear sexy underwear?
I still wear maternity underwear, but I'm gonna stop. Like as soon as I lose.
Then you're gonna go back to sexy underwear? No,
Yeah.
Let's just be honest. I think sexy underwear are totally uncomfortable. Little thong. I don't. I have a little damage back there. I don't need to be wearing. I got some
Wait.
roids to be wearing
no,
a thong.
I got one after
say
I
it.
had my daughter. I'm not bragging, but my doctor was like, geez.
Yeah, it's the worst.
Yeah.
Nothing.
I had no idea.
Not only are you trying to like make this that people see look better, you're trying to squeeze into like girdles and Spanx
You're like
and whatever.
an
On the other
animal.
end, it looks like your ass is blowing a bubble. I
Yeah.
do not know why it has to be
Mine
so
was
hard.
like an angry, aggressive, like
Exactly.
a small fist. It was like a baby was trying to come out of my
No, so
derriere.
you're-
Come on, you forgot about me. After 5 weeks, here I come.
Let's
And
make this situation harder.
there's not one part of your body that doesn't hurt. Everything hurts. I'd go up to my husband and be like, just punch me in the face so
Let's
all
get it
feels
all
the
over
same.
with.
So you're like, your hair's falling out.
Yeah, your hair falls out. When you have babies, your hair falls out right here.
I got male pattern baldness. You could really only notice it in pictures so that it's around forever. It all fell out in these like delightful triangles and then all grew in white.
Yep. Because it's
White.
not bad enough. You mean
Yeah.
like the ones that I don't have covered up right now because I have no time for myself?
Listen, I randomly pee myself. Just actually when we were talking doing makeup, I peed a little bit. Like it doesn't even mean anything.
Oh, God.
It was just like I thought about peeing and I peed a little bit.
I
'Cause
went
was
to a
like, oh, I better
trampoline
go.
park with my
No.
jumping, jumping.
Mm-hmm.
And I went to the bathroom and I was like, well, I don't have to pee anymore.
If you laugh, and
Is
you
it
didn't know
laugh-
you were gonna laugh.
Yeah, or sneeze pee. Whenever I sneeze, I hold my vagina. My husband goes, holding it
Yeah.
doesn't help. And I was like, it kind of does. I feel like if I like grip it hard enough, it sort of keeps
Really?
everything in. So I
Yeah.
sneeze
Yeah.
and grip at the same
How long
time.
is the video?
He's
I don't
like,
even care.
You're
I-
disgusting.
It's finishing
We
now.
got your back.
Okay.
Yeah.
We've been there.
Yeah.
Yes. You've been there. True. Very true.
So let's talk about involution of the uterus. So this is the process of the uterus returning to the pre-pregnant state. So when you're not pregnant, your uterus is only 60 grams and it only holds 3 to 5 mils. And when you're pregnant, at the end of pregnancy, the uterus grows to a 1 kilogram structure and it can hold 5 to 10 liters of volume. Okay, so it begins during the 3rd stage of labor and continues over the next 5 to 6 weeks. And if you've had a baby before, you will experience something called afterbirth pains when your uterus contracts. Every time you breastfeed or, when it's contracting and it's involuting, you will feel it more. Usually first-time moms don't feel it that bad. And breastfeeding makes these more pronounced because oxytocin is released during breastfeeding, and oxytocin is the hormone that also causes the uterus to contract. Okay, so typically the uterus is at the height of the umbilicus after delivery of the placenta, and it decreases in height by about 1 centimeter a day until it becomes a pelvic organ again at about 12 days postpartum. Then slower involution continues over the next several weeks until pre-pregnant size is attained. So along with involution, we will also get postpartum bleeding, or it's called lochia. Okay, it occurs after birth. Okay, and it's the body's way of getting rid of extra blood, mucus, and tissue where the placenta was located. And it can last several weeks, usually around 3 to 6 weeks. And it changes over those weeks. So from days 0 to 4, as you can see in this graphic here, is bright red. You may have small or medium clots, and the flow is a little bit heavy, like a period. Day 5 to 7, it changes to a light red color. The clots are smaller, the flow is medium, and is heavier when the woman is more active. Day 8 to 14, it becomes like a pinky brown color, no more clots, and the flow is pretty light. And around this period, most people move from wearing a pad to using a panty liner. And then week 3 to 6, it becomes light brown and yellow and no clots at all. And then it will slowly taper off. Okay. Right. So the red flags for lochia is if the woman bleeds, has excessive bleeding. So golf ball sized clots are not normal. And also if she soaks a pad in an hour, that's not normal either. So that means that there's something preventing the uterus from clotting, from clamping down and contracting down. And why that is important is because like where the placenta was attached to on the inner side of the uterus, the muscles have to contract to tie off all those blood vessels that the placenta was attached with. right? So the uterus is a very special muscle. It's one has fibers that crisscross. So when it contracts, it all crisscrosses all these muscle fibers. And when they crisscross, they tie off all the blood vessels. So why do they bleed? This crisscrossing of the muscles is not happening effectively, usually due to like a little bit of remnants of the products of conception. So it may be a tiny little bit of, even if there's a tiny little bit of membrane left that wasn't delivered, or a tiny little bit of placenta that doesn't come away, that uterus is unable to contract down. Okay, so that's why it's very important after delivery. In the third stage, usually the midwives are very interested, kind of like, really examining the placenta really carefully, just to make sure that there's nothing left in the uterus, because if there is, it could stop the uterus from contracting down, and bleeding will occur, like, excessive bleeding and hemorrhage. Okay. Other red flags is if the lochia smells bad. Okay, so malodorous lochia, and by bad, I mean you can smell it the minute you walk in through the minute you come in through the house, the door, you can smell it, or you walk in through the room where the woman is, you can smell this lochia. So she has some infection going on there. If she has a fever that's higher, temperature is higher than 37.5 degrees Celsius, that's also, indication that she may have an infection going on, and that needs, antibiotics and needs treatment. Okay. When the periods recur, they come back, the range is around 20 to 120 days. If they're breastfeeding exclusively, they may not return for months. Unfortunately, I was not so lucky. I was breastfeeding exclusively, but my periods returned within a month, and I continued to have periods monthly, even though I was breastfeeding. So I wasn't one of the lucky women that had their periods stopped after, while they were breastfeeding. It isn't just because they're not having a period, it doesn't mean that they're not ovulating. Sometimes they're ovulating and not releasing eggs, but in 52% of women whose periods return in less than 60 days were already ovulating. So don't use the fact that they don't have a period as a form of birth control. It's not a guaranteed method. Perineal heating. So babies come through like it's a vaginal delivery. The babies come through and there's tears, there may be stitches, they may have had an episiotomy, they may have hemorrhoids. So hemorrhoids occur usually in pregnancy. They are just like varicose veins in the anus, and they could be prolapse hemorrhoids. It could be outside, it could be inside. It's just the veins, with the hormone relaxing them. They're not so, the valves are, faulty. And so they have all these little grapes by their bum, just like the video said, sometimes it feels like a fist. So yeah, what can we do to help? So sitz baths. So this is this one is sitz bath, or if you have a bidet at home, or if you just have a bucket of water, or you have a bath that you can go and soak your perineum in, just do that. Use some Epsom salts, that usually helps. Tuck pads, we'll talk about tuck pads and Epsom salts, using a peri bottle. So in Malaysia, of course, most houses you have a hose pipe in your washroom, so you don't need a peri bottle. You can just use the water from the hose pipe to kind of rinse the area as you're peeing, because your pee is can sting the stitches. So you want to dilute it down. You can use the peri bottle to help, and of course it helps you keep the whole area clean. So tux pads or homemade padsicles, I had a look to see whether you could get these in Malaysia, and I think you can. They're just like little pads that are soaked with witch hazel, and it's cooling. And so when you apply it to the perineum that has stitches and is sore, it will help with inflammation and will help make it feel a little bit better. And the cold will also alter the sensation of pain. But we don't really want to use tuck pads too much or anything too cold that will reduce inflammation so much and make the area too cold, because inflammation is important for healing. I mean, one of the first responses to healing is inflammation, so that it brings more blood into that area so that area can heal. No tampons for 6 weeks, and no sexual intercourse until lochia has stopped and doctor gives the okay. All right. Usually the perineum will start to heal around 4 or 5 days postpartum, depending on the mode of delivery and the tear and the episiotomy and the stitches. So red flags here, the perineum starting to feel better already, and then all of a sudden starts to feel, worse again, starts to swell or starts to be more painful. So this needs to be checked. Again, fever and, fever is another sign that something's not going right. Okay, pelvic floor changes. So we saw in that video just now, they were talking about, the women were talking about leaking urine. So the urethral complex is dislodged from its original well-supported position as the baby comes through the birth canal. So this change is temporary. It just weakens the bladder, it just weakens the sphincter. So that's why a lot of people feel, urgency. First they don't need to pee, and all of a sudden they need to pee, but then they feel like they really, really need to go to pee quickly before they have an accident. And when they get there, they pee, and if the pee just comes out like a waterfall, there's no control. But, that's normal because, a baby's just come through that area, right? So, and it's also normal when you're coughing, sneezing, and laughing. It's temporary, occurs while the bladder pelvic organs are rearranging themselves. Wear pads, to protect yourself until it subsides. And then, if it doesn't get any better, especially by the 3rd month, you really ought to be referring your patients on, or your clients on, or your friends on to specialist physiotherapists, pelvic floor specialist physiotherapists for rehab of the pelvic floor muscles. Because if they don't get this rehab done now, they will continue to leak for the rest of their lives. So how do we know if your pelvic floor muscles are strong? So one of the things that we used to do as nurses, we used to say to patients, oh, you want to test, if you're a gynae nurse, you want to test your pelvic floor to see if it's strong. When you're having a pee and then see if you can stop yourself from peeing. If you can stop yourself almost instantaneously, your pelvic floor muscles are strong. If you can't, and it takes you a little while and you're still leaking and you can't stop yourself, that means your pelvic floor muscles are weak and it needs some work. So that's good to test how strong your muscles are. And in the past, we used to say, okay, do that. If you do that 2 or 3 times, it's good exercise for your pelvic floor. And evidence has shown that that's not so great because that causes like retrograde urine back up into your bladder and stuff like that. And that's not so healthy. So they say, do those exercises when you're not actually peeing, like, pull your pelvic floor muscles up. And hold it there for a few seconds and let it go. And do it like when you're sitting down, when you're shopping, whatever. Nobody will know that you're exercising those muscles. But then there's been recent research that says that, actually those Kegel exercises are okay, but they're not really the most efficient. And actually doing deep squats are more efficient because the biomechanical scientist, Katie Bowman, discusses that the pelvic floor should be more of a trampoline than a hammock. And when we squat deeply, and in Malaysia, I grew up with a squat toilet. So I think I have really good pelvic floor muscles because like deep regular squats creates a posterior pull on the sacrum, which helps to pull the pelvic floor more firmly, and strengthening the glutes to help create the posterior pull of the sacrum and strengthen the pelvic floor. So basically all of us who grew up with a squat toilet, I think our pelvic floor muscles are in good shape. But this is something that you can encourage women to do. She is a Caucasian lady who has obviously not had a squat toilet. So she has a prop to help her, put her heels down, because a lot of people who are not used to squatting will not be able to squat with their heels down. So that's why she's got a prop here. Okay, diastasis recti. So this is the separation of the 2 sheaths of muscle that makes up our rectus abdominis. And when we're pregnant, the pregnant bump actually separates the rectus abdominis. And it should go back in time. By 6 weeks, it should be, examined by a physio or the obstetrician just to see if the muscles have drawn back together. And if they haven't, then, and it's more, the gap is more than, 1 finger width. So that you have 2 finger widths, there's a gap there, then that woman should be referred to for physiotherapy, because if she doesn't, then it could lead to chronic lower back pain because that's the core muscles not being strong, urinary incontinence, a belly push. So like, she's not pregnant, but she looks like she's pregnant. And, it definitely does require physiotherapy if the gap is wider than one finger width. So I'm not talking about all hormonal changes and just a few, that we see. So plummeting estrogen and progesterone levels, it plays a role in mood changes. I'm not going to talk about, all the postpartum mood disorders. That would take another webinar. So with all these fluctuating and rapid change of hormones, a lot of women do experience baby blues, usually around day 4 or 5. And when the milk is coming in, everything is happening. And, you know, she may cry for no reason. She may just feel so sad, or she says, I'm so happy, and then just burst into tears. I did that actually at day 10. I was in Sainsbury's in the UK. That's a grocery store. And I saw a friend of mine who was my midwife who was attending to me in labor. I saw her and I just burst into tears for no reason. So she said, what's wrong? Nothing's wrong, but I was still crying in the supermarket. So yeah, that was funny. But if this lasts longer than 2 weeks, so this, you know, tearfulness and crying for no reason and like just not feeling happy lasts for longer than 2 weeks, it may be something more serious. It may be, you know, the start of postpartum depression. So we would like to encourage our clients to see a doctor at that point. Now, the other thing I want to mention is the big red flag here is that if a woman tells you, oh, I don't really feel like myself, you know, I keep hearing voices, these voices are telling me, you know, that you know, my son is Jesus, or anything like that, that they're hearing voices to harm themselves, to harm their baby. This could be the start of postpartum psychosis, and it is a medical emergency, and you really need to act on it, and you really need to, you know, tell a medical professional or get her referred to somebody, you know, medical services quickly, even going to the emergency room, going to A&E for this. A couple of years ago, the hospital that I worked in, and I trained at in Bristol in the UK, a mother with a four-day-old baby, she just walked out of the hospital. I don't know why nobody saw her walking out with this baby. She walked out of the hospital and she walked to Clifton, where there's a huge gorge. So like, you know, there's lots of rocks and then there's a huge valley, and she jumped off and both her and her baby died. So this bottom one here, you know, that's a big red flag. And if anybody you know who's just had a baby and says, oh, I just, you know, I'm just not myself, and, you know, I keep hearing all these voices, you really need to get them seen. Night sweats, also caused by hormonal changes, and also the fact that, you know, our body needs to get rid of all the fluid that we've put on while we were pregnant. So when we're not pregnant, there's about 5 liters of fluid in our body. When we're pregnant, we put on another 2 to 2.5 liters for the baby. So once we've had the baby, we don't need all this fluid. We need to get rid of it. We'll have massive diuresis. We'll pee a lot. And the other thing that can happen too, is that we start to have night sweats. And it affects, like, you know, about 29 to 35% of women in pregnancy and postpartum. Okay. This happens because of the low levels of estrogen. Yeah. So how to help with night sweats? Get them to stay cool, not to wear too many layers while they're in bed. Now, drinking cold water might be a problem for Chinese clients, and maybe even Malay clients. You're told not to drink anything cold after you've had a baby. This is a very cultural thing. And so instead of cold water, just lukewarm water. Don't drink, you know, hot tea, hot water. That's going to make you even hotter. Eating more soy. Soy is a phytoestrogen, so that may help combat some of the hormonal changes. Wear loose natural fabrics, cotton, linen. Don't wear, you know, like polyester stuff, because that's not going to help. You can wear, if you're very sporty, you may have some stuff that has wicking qualities that you can wear those too. Limit the trigger foods. So there are some trigger foods like trigger foods like spicy foods, caffeine, alcohol, hot liquids. They can make the hot flushes worse. Try relaxation, breathing techniques, or hypnosis. Eat well and exercise. Obviously, change the sheets. You can put a towel on the bed over the sheets and the pillow. If they have a night sweat, then they're just sweating onto the towel, and then you can remove the towel and put a clean towel on, instead of having, like, you know, to wake up in the middle of the night and change all the sheets, which would be a lot of work. Eat well and exercise. Right. Breast changes. So again, hormonal change as well as a neurohormonal change, like as baby goes to the breast and starts to suckle and feed and eat, drink colostrum and stuff. As baby is doing that, the body's hormonal reflex will start going and will start to produce milk. Also, the lowering of estrogen will also start lactogenesis. So it's normal for breast to become larger and feel heavier, warmer, and uncomfortable when milk production increases in quantity at about 2 or 3 days, when the levels of estrogen falls. More blood volume in the breast, and it really rarely lasts more than 24 hours. and the breast and areola remain soft and elastic. Milk flow is normal and does not affect baby's ability to latch on the breast. So this is just normal breast fullness. If the baby doesn't remove the milk at this point in time, what may happen is then the breast may become engorged. And a lot of people will talk about this. I'm so scared about breastfeeding. It's going to be very painful. My breasts are going to get very hard. You know, it doesn't happen to everyone. It does happen to quite a lot of people, but not everyone. And it's a problem of milk removal. Okay, so when you don't remove the milk from the glands that are filled with milk, then what will happen is there's excess fluid around the glands, and then, you know, it becomes swollen and it will pull the skin tight, and the nipple may become flattened, and it's all very tense, and it's hard for the baby to get on because the breast is hard. So what is it and how can we help? So it's not a normal process in breastfeeding. It's a problem with milk removal, causes all the things I just mentioned. And if the woman is deciding not to breastfeed at all, and this happens, it will happen because of the hormonal changes, just apply cold compresses and wear a supportive fitting bra and just wait a few days and it should all go. Binding is now no longer recommended. And also we don't really give treatments for this unless, you know, she's not breastfeeding because she lost the baby. Then medication might be prescribed for those circumstances. If she's breastfeeding, encourage the baby to feed and help the baby to latch on first by softening the breast. And how do we soften the breast? We can apply heat, we can massage, and then, you know, try to hand pump or use a machine to pump a little bit out of the breast until the breast is soft enough, and then try to latch the baby on at that point. Once the baby has finished feeding or you're finished pumping, then we want to apply a cold compress to stop the process so that the body knows that, you know, okay, that's enough. We don't want to produce any more milk, right? And then this reverse pressure softening is to help soften the areola and the breast. And so what you do is you place the tips of your fingers on the areola and applying pressure for 60 seconds. And this will help to soften the areola, which makes latching or pumping easier. There was something I was going to say, but I can't remember now. Yes. So yes, when the breasts are engorged like this, it's painful. The pain signals the fact that the cells are in danger of being damaged and dying, the milk producing cells. So if we don't relieve this pain, then what will happen is the cells will die, and then they will not come back again in this period. And the next time any milk producing cells will be made will be at the next pregnancy. So remember I said, if you're not breastfeeding, don't do anything, apply cold compresses and just wear a fitting bra and eventually it will go. They can take some anti-inflammatories like ibuprofen if they're not allergic to it and they're open to that. Or some acetaminophen or Panadol or paracetamol to help with the pain, and it will eventually go away because all those cells will die and they will no longer produce milk. But if they're intending to breastfeed, then you want to make sure that they hand pump, hand express or pump or get the baby to feed until their breasts feel comfortable and no longer in pain. If they're pumping and not feeding, pump until the breasts are comfortable and then stop. Don't pump until the breasts are completely empty, because that will signal to the body that this baby is really, really hungry and you need to produce more milk. So only pump until the breasts are comfortable and no longer painful, and then you apply cold compress and stop. Okay, we talked about hair loss. So this is just an interesting picture of hair loss, like in the video was mentioned. And this is what happens. It just falls out because, again, estrogen prolongs growing when you're pregnant, but after pregnancy, estrogen falls. And so all those hairs that were growing and growing and growing, that should be in the resting period, now starts to fall out. And around 3 months, it will fall out. And then normal hair regrowth returns around 6 to 12 months. And then overall body soreness and joint pain, I thought I'd just mention this. So a lot of people feel like, they got run over by a truck. Usually this is because of the hormone relaxin, having relaxed all our joints in pregnancy. Now we've given birth, and sometimes when if they are in labor and they have an epidural and they're pushing in positions that they're not even aware that may cause pain. So that's why they have, overall body soreness and joint pain after delivery. But it should go, in a few weeks. It should get better, even in a few days. And fatigue, again, it's not unusual. You know, they've spent 40 weeks making a baby from 2 cells. They've made a whole new human being. So it's not surprising their body has been through a lot. Then they had to go through labor. And if it's a first time mom, the labor could be like, you know, last for a few days, you know, to get them into active labor. And then from active labor, it could be like another 10 to 12 hours before the baby is born. So of course it's tiring. And then, you know, then the baby's keeping them awake at night. And if they're breastfeeding, you know, they've made this baby and now the baby's out and they now have to make milk to feed the baby and look after the baby and care for the baby. So fatigue is, you know, a common feeling. Okay. Cesarean birth. So I just looked up these statistics for Malaysia. I had a Canadian statistic there, but I've just changed it. So in 2020, approximately 23.2% of women who gave birth in Malaysia had a cesarean section. Now everybody thinks, oh, you know, just have a baby by cesarean section is great. You know, like I can plan when the baby's coming or whatever. But people forget that, you know, cesarean sections are major abdominal surgery. And recovery can be long and is painful. So just like any any major surgery that you have, it's major abdominal surgery. But now you're going home with a baby that you have to look after and feed, right? So so the birth recovery can affect mother and baby bonding because she can't hold the baby comfortably because she's in pain. Can affect breastfeeding because if she had a cesarean section, especially a scheduled cesarean section, she doesn't have all the hormones that were involved in labor. None of the oxytocin is flowing, and oxytocin is just one of those hormones that's needed for breastfeeding. Ability to care for the baby because she's, you know, in pain and, you know, she's not allowed to lift anything heavier than the baby, right? Difficulty performing daily tasks, stair climbing, lifting, and concerns about her body's availability and future birth. So some people really wanted a vaginal delivery. They ended up with a cesarean birth, and that may play on their mind. It's like, okay, you know, what are the chances of me giving birth naturally the next time? Actually, it's quite high, something like 75 to 95% success rate of having, depending on why she had the cesarean section, of course. Okay. So remember when, you know, a mother's had a cesarean section, you know, it's tough. It's tough for her. But I know a lot of women bounce back really quickly because they have to, because they have a baby. But, you know, and I'm quite amazed at how fast some women recover from this major abdominal surgery. But the care will be the same as anybody who's perhaps even had a hysterectomy, you know, because it is a big abdominal surgery. So let's go through some of the warning signs and red flags. Remember, I mentioned earlier, blood clots larger than a golf ball, soaking a pad in less than an hour, fever above 38 or any fever really, mom reporting visual disturbances, headaches, malodorous lochia, perineum not feeling better after 4 to 5 days, CS, incision, signs of infection more painful, and nausea and vomiting, inability to pee, lack of appetite for several days, and hearing voices, so postpartum psychosis. Let's go back to this reporting visual disturbances and headaches. This is quite important. This actually happened to one of my clients. She went home, and after 2 days, she lost her sight. So she was taken back into hospital, and she had HELLP syndrome, which is hemolysis, elevated liver enzymes, and low platelets, which can happen. It's a complication of pregnancy and also postpartum in a postpartum period. So her blood pressure was high, and her enzyme, her platelets were low, and so she stayed in hospital for a couple of weeks, getting better. Her eyesight did return, and I was called in to help with the babies, helping the dad look after the baby overnight. Fever. Any parent that, any mother that has a fever after delivery really needs to be investigated. Again, I think it's kind of like so rare, but I also was called in to help a family who, unfortunately, the mom died at 5 days postpartum.
Oh my God.
At 2 days, at 2 days or 3 days postpartum, she had a fever and she complained of a sore throat, and then she went into hospital and she had strep A and got sepsis, and she died day 5. Oh so don't take this lightly. These are real warning signs. Fever, visual disturbances. Of course, the bleeding and all that is also very important, but like these are, you know, can be catastrophic. Bleeding, fever, and the hearing of voices because of postpartum psychosis. So we talk about doula. So remember doula. So I am a CAPA trained and certified childbirth professional.
What does CAPA stand for?
CAPA stands for Childbirth and Pregnancy Professionals Association.
Okay.
We provide physical, emotional, informational support to our clients. You know, we offer feeding assistance and education. It could be breastfeeding, it could be formula feeding. We are the experts of newborn care. We offer household assistance. You know, we're not going to clean their stove, we're not going to clean their windows, but we will like generally tidy up. Maybe if there's some dishes left in the sink, we will wash up. Anything that will make the mother's life a lot easier after the parents' life easier after delivery.
Do you cook?
Yes, I cook. I do a lot of cooking.
Yeah, you do a lot of cooking. Do you
I do a lot of
traditional dishes like the Chinese way?
Yes, so I do a lot of ginger chicken, a lot of ginger fried rice. I don't normally do the chi gok chou. I don't do the pig starters because usually a family member somewhere has already started it. And then there's a lot of Hong Kong people here, so they do it very different to how we do it in Malaysia. They start doing that vinegar and chicken pig starters in vinegar. They start it more than a month before the baby is due.
And do you support a lot of Western, I mean like
Yes.
Asian families? Are they into this kind of practice?
So not so many are into this kind of practice, but you will be surprised at how many, you know, not that many, but there are some. There are quite a lot of Caucasian, I would say Caucasian, not like us Asian. So Caucasian people in Toronto, we're very diverse here, but there are quite a lot of them that are really into acupuncture, traditional Chinese medicine. In fact, in July, I have a client who is, she's Greek. She's doing her traditional Chinese medicine training, and she has requested for Chinese postpartum meals and doula. So one of my doulas is going to support her that knows more about the Chinese dishes than I do. I know quite a few, but I don't know, you know, the whole thing, like, you know, week 1 eat what, week 2 eat what, off by hand. I have it all written down so that I'm doing the correct thing for them, but I don't know it in my head. But I've got a more experienced doula that can go and support someone, especially if she's, you know, studying traditional Chinese medicine, and better send someone who really knows the traditional methods than me. I'm kind of like a little bit more westernized. I'm a little bit of a banana, right? So yeah, so remember, like, you know, household assistance, you know.
Or do you do your doula work? Oh.
Do I do training more or doula work more? No, I do doula work more. Trainings, I have kind of like 3 or 4 trainings a year.
Oh, that's
depending on.
Okay. And is there this training for people to be trained? Must they be a nurse or some?
No,
they
don't have to be a nurse. No.
Okay. So they don't have to be a nurse, but it would be good if they are a nurse, right? Because they have so much.
Yeah. Yes, if they were a nurse, it would be good, because then, you know, it also, you know, when you go to look for clients and you put that down in your resume or on your website that you're also a nurse, they will kind of, in a way, trust you more, even though the doula role is not one that is clinical. You know, you can still use your knowledge and your skills. They're all transferable, right? And that's why I would like to say that I'm quite successful here, because the minute my clients read on my website that I used to be a nurse and a midwife, it's already almost guaranteed that I get that contract.
And
the ones that
do you stay in? Do you stay in?
No, I don't stay in. No, I just go. We do night shifts, which are usually 10 o'clock to 8 o'clock. So it's only 8 hours. Sorry, 10 o'clock to 6 o'clock. It's only 8 hours. And then daytime shifts, we say a minimum of 4 hours during the day. So if they want cooking, usually it's around 6 hours. Yeah, but you know, Chinese traditional cooking around 6 hours, but other cooking around 4 hours, 4 to 5 hours.
And this, sorry, is this your last slide?
This is my, these are my
yes,
contact details if people want it.
Yes.
And then, yeah.
Okay, she's on Instagram. She's also on Facebook, and she's also on.
I'm also on LinkedIn. I haven't put LinkedIn in, but that's fine. You can find me on LinkedIn. You can find me on IG. You can find me on Facebook. Yeah, I didn't put my Facebook down, but I am there. Cherry Blossom Doulas. You'll find me, and Thornhill Doulas too. Oh, I have a typo here. It's Thornhill. Let me correct that.
Okay.
Okay.
Sorry, if you don't mind, can you stop sharing? Because I need to share the registration for the E. Oh, you can just do it like that. Huh?
Yeah, okay. So question and answers, my last slide, and then thank you guys.
If you have any questions, please either raise your hand, or you can actually put it in the chat group. So this is the registration for the nurses to get your E-cert. Okay. But how long have you been doing this doula?
Since 2013, doula.
Doula.
Doing the doula.
Okay. Okay. So you've been, it is quite a long time. 2013. I've been following your career since then. I know that.
You really? I didn't know you were following me, Betty. Oh my goodness.
All the time. I even see
trolling
the dishes that you cook. You'll be okay. And Suyin, right? She has a passion for knitting. So so she also knits for the babies and the mom, and she knits on things to help on how to breastfeed. Yeah. So okay, you know why I follow you? Basically, I'm very interested in following a lot of women's career. I like them to succeed. And also because I know you went through a phase where I think I stopped recording here first. I think you went through, hold on, let me stop recording.